Well, thousands of kids across our Hoosier state are returning to the classrooms this week for the spring semester, and COVID cases among kids is rising. Emily Longnecker has a look at the number of kids Riley Hospital for Children is treating right now.
Well, since the beginning of the pandemic, children's lives have certainly been impacted from their schooling to their activities. Now, though, the COVID numbers are showing that kids are directly being impacted by the virus in a big way. The doctors here at Riley Hospital for Children say they are seeing 4 times as many COVID patients right now as they have at any other time during the pandemic. And of their COVID patients right now in the hospital, more than half are in the ICU. 40% of those ICU patients are on ventilators. According to doctors, right now, Riley has 32 COVID patients total. 9 are pregnant mothers. 11 are in the PICU. Doctors say kids are coming in sick with other illnesses, too. 77% of in-hospital COVID patients, they say, are unvaccinated. Staff is also getting sick. That's led to a team of Indiana National Guard members set to deploy a team to Riley by week's end.
Well, today the CDC will meet to discuss booster shots for kids between the ages of 12 and 15. Just this week, the FDA granted emergency use authorization for Pfizer's booster for that age group. And yesterday, the CDC authorized a 3rd dose of the Pfizer vaccine 28 days after the 2nd shot for kids with a compromised immune system between the ages of 5 and 11. In the next week or two, the state health department expects the CDC to update its guidance for schools, but Indiana health leaders recommend the safest and most consistent guidance in school environments is having everyone consistently and correctly masked, regardless of which guidance your district chooses to follow. And as you can see, there's quite a high demand for testing, with long lines at the testing and vaccine site outside the Indianapolis Motor Speedway. Because of the demand, the state's now limiting rapid tests at state and local sites for people 18 and under, but if you're 50 or older, you should still be able to get one. And at IMS, the clinic there is making it easier for the age group to get tested without an appointment. Walk-ins are accepted between noon and 4 p.m. through Friday. Well, the college football national championship game is coming to town. With all the excitement, it's easy to let your guard down when it comes to COVID precautions. So our Lauren Kostick is taking a look at what fans need to know before the big game.
Welcome to Indianapolis International Airport.
Indianapolis is preparing to host 100,000 fans this weekend for the college football national championship.
It's the beginning of an exciting week.
But as the city prepares for this massive event, IU health leaders are pleading with Hoosiers, saying their hospitals are either at or above capacity, calling this latest surge crushing.
We have turned conference rooms and ambulance bays into spaces where we care for hospitalized patients. That has not been the case before COVID.
NBC News found Indiana is one of 16 states that recently set records for both hospitalizations and cases. This is why doctors and city leaders are asking fans to play it safe this weekend, stressing that if you are sick, stay home.
If you have a cough, if you have a runny nose, if you have a fever, please do not attend an event. Don't attend an event with your family, and don't attend the college football championships.
Even though the city has pulled off large sporting events post-pandemic, this time there are fewer restrictions. Lucas Oil Stadium will be at full capacity, and masks are not required but strongly encouraged, which means the city is also not requiring fans to get vaccinated or tested, something one local doctor disagrees with, saying on Twitter, "We could have required this simple thing, and we didn't." It's a decision Marion County is leaving to fans.
People know what it takes in order to be safe. Wear that mask while indoors. Get vaccinated with the boosters. Get themselves tested.
And we also reached out to Eskenazi and Community Health about the upcoming crowds. Eskenazi referred us to the health department, and Community Health did not respond.